Healthcare is a priority, and healthcare professionals on the front line even more. Our first responders are privy to managing extreme morbidity and increased mortality. They have to protect themselves to protect others, this both physical and in the psychosocial realm. It is to that end we are here today with the overarching support of the Ministry of Health, the Ministry of ICT, Equity Foundation, Konza Technopolis, and a culmination of 3 cadres, doctors, nurses, and clinical officers to launch the COVID-19 Contact Center to support our own health professionals on the front line. It is to that end I would like to invite Stella Githaiga to initiate this auspicious occasion with prayer.
Good afternoon, ladies and gentlemen. The CAS ICT, Honorable Joe Musheru, the CAS Health, Dr. Mwangangi, our distinguished guests, members of professional associations in health, invited guests, ladies and gentlemen, kindly join me in prayer. To come and participate with us, and we really appreciate where we are right now.
I would now like to invite Alfred Obengo, President, National Nurses Association of Kenya, to give opening remarks and also introduce his colleagues from our other professional associations. Thank you.
Ministry of ICT, the Chief Administrative Secretary, Ministry of Health, the KNH CEO, Dr. Evanson Kamuri, other distinguished guests, fellow leaders, professional associations. Today is an historic moment where all healthcare professionals and their leadership have come together to take care of themselves in terms of psychosocial support and our mental health, given this unprecedented war of COVID-19. I also want to thank our partners, specifically Konza Technopolis, for offering the physical infrastructure. I also want to thank the Equity Group for offering to support our health, our human resource component, our professionals who are going to offer the psychosocial support at our call center. I don't want to say much, but I want to recognize leaders who are here. I'll start with Mr. Albert Taiti, who is the chairman of Kenya Clinical Officer Association. You just raise your hand where you are. We see you. Thank you. That's a demonstration that we are all here. Anyone representing the Kenya Health Professional Society? I think Taiti, you are representing them all. And then I'll also give a chance to the KMA President, Dr. Jackie Kitulu, to make her remarks, and then we proceed because of time. Thank you so much. And welcome to the Nurses Complex. This is the headquarters of all nurses of Kenya, where we attend to their welfare and professional issues. Karibuni sana na Mungu awabariki. Asanteni. Jackie.
ICT, the CAS for Ministry of Health, and all protocol observed. Let me use that so that I don't leave out anyone. Thank you very much, Alfred Obengo, for hosting us here. And this is indeed an exciting day, an amazing day for all of us who are healthcare workers. Indeed, in the health system, we know that the human resources for health are the most critical group in that building block of the health system. Because if we remove the healthcare workers, then we have another system, but not a health system. because ours is a service industry. Most of what is done for the patient is delivered by people. Those people are represented here today. They are the nurses, they are the clinical officers, they are radiologists, lab technologists, the doctors, the mental health specialists, the counselors. Every single healthcare worker is represented to ensure that we offer quality healthcare to the public. So at this point of the COVID-19 pandemic, it has come to the fore and even come much clearer, not that we were not aware of it, that mental health is very critical for the healthcare worker. Therefore, psychosocial support is fundamental to ensuring that we continue to work without burning out. So we really want to appreciate each and every supporter who has been part of this process. The Equity Fund Group, the Konza Technopolis, and each and every healthcare worker who has been part of that process. Dr. Njuguna, I don't know where you are in terms of mental health. We were just talking and saying Dr. Njuguna is the composite of mental health. He's mental health head at the ministry. He's the president of the Psychiatric Association. Him and his team have been amazing in setting up the processes that we have made this possible. There's Dr. Liz Kaemba from the, Dr. Liz, yes, from the clinical psychologists. These are teams that are making sure that our services that will be rendered in this call center are actually backed by professionals. We have within, I mean, I may not mention all your names, but each and every one of you who have even presented in the weekly webinars in which we've had, all building up towards this process. We want to say asante sana, Dr. Joy Mugambi, Professor Atoli. You've all been critical in writing, you know, what this document, what it needed to be, and it's coming alive today. So I just want to say a hearty thank you to each and everyone who has supported it. And for us healthcare workers, this is our resource. We have been called to serve. This is our job. This is what we shall do every day. But just as the good book says, love your neighbor as you love yourself. So if we are not loving ourselves and taking care of ourselves, then we become inadequate to offer the services that we should. So this center is for us. Let us use it. Let us learn from what we shall pick up from it to ensure that we offer these services around the whole country and make our work much easier. Thank you so much.
Good afternoon. Good afternoon. Yeah. Today, my work is very easy. It's just to welcome you to Kenyatta National Hospital. This complex is within Kenyatta National Hospital. The chairman is one of my staffs. So, and we don't quarrel about rent and such things. But today, more so, is something we are excited about. This center, as you've heard, is a psychosocial support. All Kenyans are worried about COVID, which means all health workers, because they are Kenyans, they are also within that bracket. But on top of that, all health workers are also worried about Kenyans getting COVID. So you can imagine they carry the burden of COVID twice. And all along, nobody has actually thought about them until now. And we thank ICT, we thank Equity Group, and we thank colleagues for thinking of their own colleagues. For once, we are taking care of ourselves in terms of sympathy. Doctors, nurses, lab people, they also cry. I know you've only heard the rich also cry. But even doctors, they feel pain, they cry, but occasionally they also laugh if there is something to laugh about. So this support, we are excited about it. We are rolling it out the whole country. Everywhere there is a medical worker, and Waziri, we are very grateful for your ministry. CAS, we are also very grateful to the ministry for supporting this noble cause. For me, those were my words, and karibuni Kenyatta, asante.
As Equity Bank, we saw it that after being in this country for the last 36 years, the biggest test that has come to us as a country is during this period. And we had to come out strongly and stand for country first. And that's why we have been very, very focal in our contribution towards the fight against this pandemic. And we shall do more. The board of Equity, a bank and the foundation have put in place the structures that we shall be with Kenyans and walk the journey with Kenyans until we defeat this war. Waziri, as a foundation also, we are making very, very aggressive measures to see that we open up affordable clinics all over the country. And why we are doing this for Kenya is to thank Kenyans for what they have also done to us and the support they have given us. So count on the support of the bank, even as you establish the call center, wherever other assistance that the governments of Kenya will require. Since we are all Kenyans, we shall be there to walk the journey with you. So I really congratulate the associations that are concerned in that noble idea to protect our brothers and sisters who are out there at the forefront. We shall be with you in that journey. So thank you.
I'm here on behalf of the DG, that is the Director General for Health. He would have liked to be with us, but because of other engagements, he was not able to come. But Waziri, with you allowing, I would just want to say three things. First, on behalf of the DG, first and foremost, we want and we wish to thank all the partners, Equity Group, Konza Techno City, and our ICT colleagues, and other supporters for, of this excellent idea that is aimed at improving the psychosocial, psychological welfare of our healthcare workers during this pandemic. The primary purpose of this call center is to provide healthcare professionals with efficient and effective physical and psychological support to build resilience and ability to handle stress and healthy and adaptive, in a healthy and adaptive way. So this center really goes a long way in motivating and creating a conducive work environment with less stress and stigma for all the health workers. And we are also encouraged that with the establishment of this particular call center, and especially adopting innovative ways, that is technology, in tackling various health challenges, that this will also assist us in better managing the coronavirus. We are therefore really greatly honored to serve humanity in various capacities as health professionals, and this is our commitment. So today, as we launch this Health Professionals Call Center, it is my desire that we be refreshed and recover fully from the disease burden. Those were the words of our Director General. And at this point, Waziri, Madam CAS, you allowing, it's now my great pleasure to welcome Madam CAS, Dr. Mwangangi, to make her remarks and also invite you as the chief guest to address us. Thank you very much.
Equity Group, Konza Technopolis, and most importantly, the Ministry of ICT for really working hand in hand with us. I do remember at the beginning of the coronavirus pandemic, the Minister of ICT was actually helping us set up Zoom calls in the office himself, not his team, himself. And this is how dedicated the ministry is in terms of working and collaborating with us. So at this juncture, allow me to invite him to come and make his remarks, And then thereafter, I'll carry on with the coronavirus update.
Hakuna spray? Huh? Is it? Okay. That way I can be able to speak freely. Good afternoon, ladies and gentlemen. I'm very glad to be here. I have a whole list of things to read and talk to you about. But I think basically, from the conversations we've had, Kenyans want really to understand what it is that we're doing today, not many of the technical things. In fact, we were talking with the CAS Mwangangi, and she was asking me, there's all these things, APIs, VDIs, what are all these technology things? So basically today, it's a big day for the health sector. First, there's a meeting going on with the President and the Council of Governors, which is why CS Kagwe is not here with us. And they are addressing the preparedness of the counties, for this pandemic and really even for the future. And I'm glad that these preparations are going on. I'm also very happy that today, as you have seen, the healthcare professionals, all of them, they've come together. This handshake, this coming together is happening in all facets. It's not only politically, but even for development. As you can see, this is taking place. And so in line with that, we as the Ministry of ICT, Innovation, and Youth Affairs, we are also partnering. We're also coming together with the healthcare workers, the frontline workers, to ensure that we're providing the technology, the facilities that are needed to make it easy for them to continue to offer us as Kenyans the services that we so require. As you have heard, they are also not immune to some of the stresses that we also go through. But for them, they even see more. They even see the suffering of many. They see even people who lose their lives. And so they also need to get support. And to be able to get support even when they're in remote areas. That's why we've been able to partner to create a contact center, a call center where someone can call from their job and be able to talk to someone who is experienced and even be able to receive help. We have people across the country, actually in 45 counties, that can be called upon to be able to provide the psychosocial support to all these healthcare workers. And to do this, Kwanza Technopolis is providing the technology in the back end that is required. There's a data center. The data center will store the information of all the healthcare professionals, but also those that are going to be providing them support, so that when you call, they can be able to call up information to know who's the best person, for instance, to give support in Embu, who's the best person to give support in Turkana, if the person calling is from that area. So it is important that you understand the technology really only works with the real people. This is equipment, this is phones, this is computers. And without real people, then you're not able to move forward. So I'm really glad that the healthcare professionals coming together with the Nurses Association, they've actually put this together, and partners like the Equity Group Foundation have come and are paying for some of these people to be able to provide that support that is necessary. During these very difficult times for many, that support goes a long way in ensuring that we continue to have sanity in the country and in ensuring that we move forward. The Konza City, which is a project that is still ongoing, now has a data center and is going to be providing equipment that can be used across all the health centers in the country. We're working on connecting all the health centers, to the data center, to the internet, so that we can see many other services being offered. Those VDIs or video devices that are to be provided, these are just terminals that can be used across the whole country, and people can be able to access information. Telemedicine. So you don't necessarily have to go, to see doctors all the time. You can actually use this technology. go to a lab, get maybe your results, the doctor will interpret those for you. It limits the amount of contact that is happening. And we are also able to provide better information. So we were talking with Susan, who's one of the professionals that's at the call center, and she was saying that for people, it's even better when they are calling and giving their problem over the phone or using technology. When it's face-to-face, sometimes you are shy to give the full picture, but with technology, you can actually be able to say even more. Obviously, you all know that's been the case with social media. People say whatever they want to say, whether it is insults or what. But I'm glad that now technology is being used even for positive benefits for everybody, and now starting with the healthcare workers. It's our intention to expand this infrastructure so that we can have all citizens being able to have a call center where they can also call to get this kind of support. So I hope I've not been very technical. I try to make sure that this is as straightforward and as easy for everybody. It is a great thing that everybody has come together. That unity that we are seeing from the healthcare workers, including the landlord. The Kenyatta Hospital is not even charging rent. So I think, Colonel, if you know that space we are looking for, ongea na yeye kidogo, we might also be able to benefit. So with those remarks, let me declare this call center open and say that this is a start, and progression of this partnership. We expect it to grow even more. Konza is very committed to ensuring that this is expanded across the country, as I said. And as we work in all this, we hope that as media, you will continue to capture these developments that we're making. And really, it is our hope that even post-COVID, we will not lose these advantages that we've gained by using technology, and that we can be able to use this even going forward. It's helping us in terms of efficiency. It's helping us in many ways in ensuring that everybody has the right information. So with those few remarks, let me welcome back CAS Mwangangi. She will now give us the numbers on COVID-19, and I hope they're not going to be depressing today. Asante sana. Thank you.
Today, again, we are very privileged to be here for our 99th briefing, and on a day where we are here to support our healthcare workers and partnering, as the Waziri has said, together, celebrating the handshake between different cadres in health, but also partnerships with different institutions and organizations. And so for that, we are grateful and we are happy to be here. And as mentioned, again today, I had a very long, elaborate speech that really tries to highlight our engagement and our use of ICT within the Ministry of Health. And what I'll do before I get into the numbers, which I'm sure is something that you're waiting for, is perhaps to just emphasize that really ICT and technology plays a key role in moving the health sector forward, and is actually fundamental to the attainment of the universal health coverage agenda. As you can see today, we are here working on, with our healthcare workers, a key building block when it comes to health systems, ensuring that we are taking care of them, that they are protected, and that they are contributing well in terms of this coronavirus pandemic. And so we do appreciate and recognize the sacrifice that nurses have made in the country as they continue to fight this virus, and not just nurses, as we've said today, but all healthcare workers. I am informed that this call center really will be able to come in handy in terms of meeting the needs of all the healthcare workers. And today, as highlighted by Waziri Mosheru, there was a healthcare worker there, Susan, who really has told us of the importance of this center, the way that this center provides comfort. This center actually encourages healthcare workers to be able to speak out and to share their experiences and whatever difficulties they may be having in the field. And as she was taking us through this, she mentioned an important component of referral systems. Again, a sector or a specialty in health that can really benefit from ICT. The idea that this call center has actually mapped out all the different mental health practitioners in the country. And therefore, the referral system is that much better. As Susan attends to our healthcare workers, she's able to redirect them to their nearest center, and we're able to harness ICT in that space. Coming back to COVID, as we started our coronavirus response early on in the year in March, it's important to note again the Emergency Operations Center again, that is housed by the landlord here and not charged. It's right there on that end of Kenyatta, was actually really utilizing ICT services. When you do visit that center, and perhaps the next briefing should be near there, you'll note and appreciate that the Emergency Operations Center really is data-driven. And in that center, through the collaboration of different partners, including WHO, Palladium Group, the Ministry of Health, they were able to design a COVID-19 digital solution. And here is where it gets tricky. So they call it the Kenya EMR web-based system. And I'm sure it has one of those APIs, Waziri Msheru, that is able to really be able to assist us when it comes to contact tracing, testing, ensuring that we are actually able to follow up that one Kenyan who has tested positive and ensure that that contact data is available and that we even have visibility of subsequent results. And that is why through our COVID updates, we've been able to itemize for you what is happening in Kamkunji, what is happening in Westlands. All those data, all those figures that you see us highlighting day after day are really through the workings of data and ICT innovations at the Emergency Operations Center. Moving forward, last week, and I think earlier this week, we were able to explain to you that we are adopting a community-based approach when it comes to the coronavirus pandemic. And again, interestingly, ICT is actually playing a role in this approach. Through ICT, we've been able to train 60,000 community health volunteers. And again, this was done through just a mobile phone. And what is even more interesting is that this was not necessarily a smart mobile phone, but one that employed, I think you call it USSD technology or mobile-based technology. So something that is, less sophisticated compared to a smartphone. And these community health volunteers now are helping us in our home-based care program. Using that application, they're able to work as monitors and evaluators of our home-based care program. Again, a good contribution from ICT. And moving forward, even as we move on to the UHC agenda and ensure that we meet the President's objective in terms of ensuring that every Kenyan has financial protection, ICT will play a key role, ensuring that each and every one of you is enrolled in NHIF, ensuring that each and every one of you is able to access the healthcare services that they need, that we're able to identify you, that we're able to reduce fraud, we're able to be more accountable, all through ICT. Now to the numbers. Today, we had 3,918 samples that were tested. 178 people tested positive for coronavirus. This brings to total our country caseload to 5,384 so far. And cumulatively, we have tested 1,055,314,000. All the positive cases, except 3, are foreigners. We have 123 males and 55 females. And our youngest today is a 1-year-old infant, and the oldest is 76. Nairobi is leading today with 100 cases, followed by Kajiado with 21. We have Migori having 17, Kiambu 16, Busia 8, Mombasa 7, Machakos 4, Nakuru 2, Uasin-Gishu, Kericho, and Taita Taveta each have 1 case. It's important to note and to appreciate that today we've discharged 34 patients. This brings the total number of recoveries to 1,857. We have also lost 2 patients today, sadly, and therefore our tally in terms of fatalities comes to 132. And our heartfelt condolences are extended to families and friends who've lost loved ones. Today, we will not be able to go through the disaggregation, but we have that data provided for you. As promised also, we've been able to provide for you a table that looks at the different positivity rates per county in terms of the samples that we've collected. And as I conclude, I'd like to express my sincere gratitude to all members who are present here today, taking recognition of all the healthcare workers who are here today. Let me assure you really, from the beginning of the coronavirus response, all these faces that you see here were not sleeping. Perhaps they might be the first customers of this call center today. I'm sure they could share lots and lots of stories with you in terms of the hardships faced and the mental health issues that come with dealing with such a pandemic. However, we are stronger today, again, through that collaboration. We've been able to set this up. And remember, we also have a similar service that is available for you Kenyans, 719, again, a call center that is in this same complex. Utilize this facility. Mental health is not an issue to be ashamed of. We all are able to, be afflicted from this or have suffered at one point or another in our lives. And so let's come together, assist each other, and try and, move the country forward. I do want to continue to urge you again and to remind you to continue adhering to the containment measures. Let us wash our hands. Let us physically distance. Let us mask. Thank you. Questions?
Thank you very much, Waziri.
Two concerns. One is on the capacity. Over 100 days now, the tests that we are conducting still varying samples, 2,000, 6,000. So have you been able to establish how we can get a constant figure so that we may know whether the rate of infection is going high or low? And number two, how many health workers have tested positive so far? And the ones that you had reported, do we have recoveries or even fatalities from that number?
My name is Bernard Gitau from People Daily newspaper. My question goes to CS Musheru. We have heard some claims that those countries that have taken and embraced 5G, they have the high cases of COVID. And in the country, we have those masks. And some are calling for them to be removed. And I don't know, that's a claim that is all over. What is your opinion on that? And my last question goes to the CAS. It goes to deal with poor sanitation. As we have the COVID in this country for the last over 100 days, we have seen the improvement in terms of hand washing and improved sanitation. In terms of the disease burden trend, have you seen the reduction? And if you have seen, at what rate? And we have seen the country have been losing a lot of money because of poor sanitation related diseases. At this moment, in the last 3 months, how much have we saved as a ministry in terms of the reduction, if there is any, on those diseases? Thank you.
My name is Mwangangi Maina from TV47. I have two questions to CS Dr. Mercy Mwangangi. First, previously you were saying you were giving us figures, a breakdown from Nairobi, especially in areas in Kawangware, Kibra, and Mathare. What happened? Those areas have ceased to become hotspots. Then question two, do we still have Kenyans or people who are in quarantine facilities, and what is the condition of the quarantine facilities? We have complaints from Thika Level 5 hospital that the situation in that place is deplorable. Thank you.
Thank you.
Hi, my name is Graham Kajula from The Standard. My question is about the Jitenge app that you had proposed earlier. What happened to it? Why is it not being used in the home-based care guidelines? And I would like an update on the 719 uptake of the emergency calls. Yeah.
Great. Thank you. Thank you. Let me start with Graham's question. So 719, call center is actually here, and it continues to thrive. As mentioned, we do have 60 medical officers who are there. Again, a partnership with Safaricom, Ministry of ICT, Ministry of Health, and different partners, including KMA, who was involved in the training of these medical officers. The hotline continues to function. However, we've noticed that there's a declining trend in terms of the calls that Kenyans are making. And so we continue to appeal to Kenyans to make use of this line. The workers are there, they're ready for you, they're waiting, they're well trained, they have the material, the knowledge that they need in terms of relaying the correct information to you. So 719 continues on and it is active. Regarding the Jitenge app, along with many other numerous apps, I'm happy that today we are here with Waziri Musheru, just because he put together a team that was looking at innovative use of ICT when it comes to COVID-19. And so I'm sure he'll help me here in providing an update as to where that team is, because this team is going to look at all these applications, ensure that the applications meet the various protocols, that the applications are able to adhere to the various laws that exist when it comes to data protection and privacy. And so I think he'll provide a better update as to how that would be looking like, but it's an application that we really see will be useful when it comes to home-based care and moving forward. In terms of a question, I think, from Purity, thank you, Purity. You've raised concern over varying samples. And you've requested that we have constant samples in a day. Perhaps what I can say is that part of how we collect our samples really is dictated by the system we've set up in place in terms of the rapid response. So usually how this works is that the team sitting at the AOC is able to receive alerts from across the country. And remember in the beginning, starting with 2 labs, we were able to move to 27 right now. So we have these alerts coming in, and this team is then therefore able to redirect that call to the necessary county. So for example, they get a call and it's coming in from Turkana. They're then able to transfer that alert to Turkana County. Turkana County is able to mobilize its county response team, and using the nearest lab to that county, they're able to collect a sample. Now, when it comes to processing of this sample, the machines that we have, and I'm happy today that I have Dr. Kamuru here, he also runs one of the COVID-19 laboratories. He will share with you and explain to you that for you to be able to do a run in one machine, you have to have collected 94 samples. And so the idea is that you've gotten the different calls from the different counties, so you collect your samples and you make sure you have a batch of 94. Then you run the test. And so because of that intricacy when it comes to processing and running tests for PCRs, the numbers can never be a constant 3,000 every day. There will be variations depending on the alerts that are coming in. And remember also, we are testing people who may be in quarantine, people who may be discharged from home quarantine. There are many, many processing and testing sort of centers that are there. So to get a constant number is difficult. But then I think also what you're calling for perhaps is increasing in terms of capacity for our testing. And I'm glad to note that the ministry has improved its capacities and continues to improve its capacities. And so in the coming days, you'll see more numbers of testing. We have kits that are coming in, some that we expect to be here. And so these numbers will continue to increase and our testing capacity will improve. Concerning the issue of sanitation, again, time and time again, we've emphasized hand washing is the trick when it comes to coronavirus, and perhaps even the trick when it comes to many other ailments that deal with water and sanitation. What we've seen is that there's been a mixed picture. We've had some reduction in some areas. We've had fewer reported cases of diarrheas and choleras. And we've had, in other instances, a plateauing of the cases. What we are doing internally as a Ministry of Health is to be able to sit and look at our data holistically and perhaps look at our data beyond this time of COVID to be able to really come with a true picture of whether there's been a true reduction or a true increase when it comes to these diseases. And again, in terms of costs, it's important to note, putting a patient through treatment, say a patient who has most of the time a waterborne disease, would require admission, would require IV fluids. There's a lot of care that goes into that. So once we do our data, and our data tells us that we actually have less cases, then of course we expect to see reduced costs. Allow us to work on that and perhaps give you a quantitative figure in the future. Someone mentioned today that I said we won't share our disaggregation. What I mean is that today, because we are here and it's a very cold day, the sun is really, at the lowest tone, we will not go into disaggregation of the whole country in terms of the sub-counties and the wards that we have, but we have that information for you. Kawangware remains a spot. We have those figures. The different little areas that we've been highlighting, Westlands remains a spot. We are seeing Kilimani, that remains a spot in Nairobi, and the same of different other areas in Mombasa County and the other counties. Busia, there's a spot there again, especially at the entry for the truck driver. So this data is available. We are not saying, and I don't think we've been able to declare that any area that was once a hotspot is no longer a hotspot. In fact, yesterday we were able to articulate that Mombasa now has the highest attack rate. It means if you're in Mombasa, you're most at risk. It means when you're in Nairobi and you're in Westlands, Kilimani, Kawangware, then you're most at risk. And so we'll continue aggregating this data, and it's available for you for the whole country, for all the afflicted 40 counties. I think at this point, I'd like to invite CS Musheru to answer a few more questions, and then Dr. Kamuri will be able to explain further when it comes to the testing for COVID.
I think CAS, we should appoint you our ambassador for ICT in the way you have spoken. So thank you very much for the kind words, and really an indication of the partnership that we've held with the Ministry of Health and will continue to. EMR is the electronic medical record. which every citizen will actually have alongside the Huduma number, as that is provided. And that means wherever you go in the country, you will have your medical record following you to make it easier to ensure you get the right treatment wherever you are. You know, when things happen and you don't understand what the issues are, you always look for different reasons. And this idea that 5G is what is causing COVID in Kenya or in the world, I think there's a problem. Because in Kenya, we do not have 5G. We have not installed any 5G base stations, and I've seen we have over 5,000 cases of COVID, so it's not clear where then those would have been. But I would say right now, from a technology point of view, the technology that is used for whether it is 3G, 2G, or 5G, the spectrum that is used already exists. It's just how it is used. And so far, there has been no studies that have shown that there is any problem with 5G that we have seen, and the Communications Authority already gave a very clear response to that. So we will continue to observe and monitor, but at this stage, our networks are safe, our networks are working well, and this is what we are using for all our communication. And so I continue to encourage Kenyans to feel free to continue to use services. As regards the different applications and innovations that the country has been presenting, we've had multiple groups of people receiving the different entries for innovations and different applications. Let me start with Konza, who had a hackathon or a challenge that they put forward to Kenyans on how to fight this pandemic. And they received over 300 applications, after which they shortlisted to 48. They shortlisted and then gave them another challenge. And now they have about 15 that they have selected that have won. And those are being now coached on how to go to market. They are receiving support from funding to advisory services, and that is ongoing. The COVID-19 Advisory Committee that I established, that is chaired by the Communications Authority, has also been receiving to date over 400 different innovations. They've shortlisted about 100. We will be having a meeting next week to see how to advance those that have come forward. We are seeing some great innovations from Kenyans, and I think many of these innovations are not just for the COVID time. We will use them even beyond. What's important is that we are making sure first you patent and you protect your idea. We don't want to receive ideas and then later people are saying we have stolen the ideas. No. We want to protect people's innovations and ideas and ensure that those ideas, once they go and monetize, they will create jobs for this country and we will see a flourishing industry. The Silicon Savannah, as we call it, is our Silicon Valley, and we expect to see a lot of these innovations growing. So we are working on that, and I hope you will continue to give us your entries. Asanteni sana.
One, the corona has no respect of persona, so it's not unusual that we have also health workers admitted. At the moment, I have 5 staffs admitted, but these are not for Kenyatta National Hospital. The daycare center serves for all health workers in Nairobi metropolis, so they are admitted there. 2, will not give you facts about whether the disease burden has come down. I'll throw the question back to you. When is the last time you had somebody has a diarrhea? When is the last time you had somebody next to you coughing or having cold sores? That can tell you the numbers have come down. For obvious reason, change of habits, change of greetings, change of distancing and such things. And even sometimes our eating habits have changed now that most of us have to eat from where we cook because of obvious reason. So the disease burden has actually improved. We have registered very few, even pneumonias in children have actually come down. Diarrheal diseases have actually come down. We are actually excited. We are hoping, even after corona is gone, we would wish all Kenyans would continue having the same change of social behaviors. Why the parameters of lab would differ on different days, it has several aspects. One, from the source, who are we testing, where are we testing, and who is testing. It depends on the number of the samples that we have received and the logistics of receiving. And that's why you will notice, even on weekends, Monday, Tuesday, the numbers will change depending on the samples that are drawn. The other thing that we are doing, even from now onward, even another 2 weeks, we'll even have, the capacity has increased because the ministry has continued investing on testing equipment. Like now we have just received another testing machine in Kenyatta. Thank you to the ministry. So we will actually even double that capacity of testing, and we'll also increase the turnaround time. So we will not be giving you data for 2 days. We'll be giving you data for hours. But you must know that the testing of COVID is not as easy as it looks. It is something that takes several hours depending on the machine you are taking. However, it's good to tell Kenyans those figures you are getting, they are factual. There are many people who are saying people are cooking data. You only cook something you will eat. This is not data. So the figures that you are getting are figures that are real time. They are getting from, and in fact, we relay those results directly to the center as we pick the results from the machines. Thank you very much.
Thank you so much. Thank you. Finished. Yeah.
Hello? Okay. We would like to call this meeting to a close, but once again, we would like to thank Honorable Musheru, Dr. Mercy Mwangangi, chief guests, esteemed guests, and the media for gracing this occasion and showing true support to our frontline. So asanteni.